In 2025, cancer still casts a formidable shadow over our lives, whispered in hospital corridors and spoken with heavy hearts at home. For generations, a cancer diagnosis has felt like a battle against an insidious enemy, fueling deep fears about our health and future. Yet a new light is breaking through. Fueled by scientific curiosity, technological leaps, and a global community refusing to surrender hope. We're living in a time of unprecedented discovery, where the question, "Can we cure cancer?" is met with real optimism. The narrative is shifting from mere survival to thriving, thanks to a deeper, more nuanced understanding of the disease. Today's hope is grounded in tangible progress and inspiring patient stories, not just wishful thinking. As we explore the current landscape, let's acknowledge cancer's challenge and embrace the innovation that's making a future without fear possible. To cure cancer, we must first understand cancer is not an outside invader, but a betrayal from within. It starts when our own cells mutate, growing uncontrollably and forming tumors. This makes cancer hard to fight. Our immune system often fails to recognize these cells as threats. Cancer isn't a single disease, it's over 200 distinct diseases, each with unique behaviors and genetics. Treatments that work for one type may be useless for another. Even within a single tumor, there's a complex mix of cell populations, each with its own mutations. This diversity means a biopsy may not capture the whole picture. For decades, we used broad treatments like chemotherapy, attacking all fast-dividing cells. Now, with advances in genetics, we're learning to target the specific vulnerabilities of each cancer, and even each patient's cancer. The fight is no longer generic, it's personal, focused on the unique molecular drivers of each disease. This shift is transforming outcomes and reducing harm. Understanding cancer's complexity is the first step toward conquering it. Cancer's greatest weapon is its ability to adapt and evolve. Tumors accumulate new mutations as they grow, creating a diverse population of cells, some vulnerable, others resistant. This leads to treatment resistance. A therapy may shrink a tumor, but resistant cells survive and repopulate, causing relapse. Cancer cells are resourceful, evading drugs, repairing damage, and even suppressing the immune system. They hijack the body's systems, growing new blood vessels to feed themselves, a process called angiogenesis. Most dangerous of all, cancer can metastasize, spreading to distant organs and turning a local problem into a multi-front war. Once cancer spreads, it becomes exponentially harder to treat. This constant evolution and resistance make cancer a dynamic, formidable adversary. We're not fighting a static enemy, but one that changes with every move we make. That's why defeating cancer requires relentless innovation and adaptability. The battle is ongoing, but our understanding is catching up. For decades, our main weapons against cancer have been surgery, radiation, and chemotherapy. Surgery removes tumors directly, especially effective when caught early. Radiation targets tumors with precision, sparing healthy tissue more than ever before. Chemotherapy, a systemic treatment, attacks fast-dividing cells throughout the body, but also causes side effects by harming healthy cells. Despite their bluntness, these treatments have saved millions and dramatically improved survival rates. Some cancers, once considered fatal, now have high cure rates, thanks to these approaches and better early detection. These foundational therapies remain critical, even as new, more targeted treatments emerge. We're witnessing a revolution in cancer care, moving from broad attacks to intelligent, personalized medicine. Immunotherapy unleashes the patient's own immune system, with drugs like checkpoint inhibitors removing the brakes so immune cells can attack cancer. mRNA cancer vaccines, inspired by COVID-19 vaccine technology, are now custom-built to teach the immune system to target each patient's unique cancer mutations. Artificial intelligence is transforming diagnosis and treatment, analyzing scans and genetic data to guide personalized care. These breakthroughs aren't just incremental, they're paradigm shifts, making treatment This dynamic approach treats cancer as an ongoing process, not a single event. Focusing on the unique biology of each patient holds the key to better outcomes. Personalized medicine is turning hope into reality for millions. The era of one-size-fits-all is ending. Individualized care is the new standard. Our journey through cancer research reveals both immense challenges and profound hope. Cancer remains a complex adversary, but we're at a turning point armed with immunotherapy, genetic medicine, mRNA technology, and AI. Progress is the result of decades of research, patient courage, and scientific dedication. To keep moving forward, we must support research-fund innovation and raise awareness. Prevention and early detection through healthy choices and screenings are vital parts of the fight. Let's move forward with determined optimism, inspired by survivors and breakthroughs. A universal cure may be elusive, but a future where cancer is manageable is within reach. Together, we can build this future supporting science, championing researchers, and believing in hope. The promise of survival and thriving after cancer.
Today, we're talking about a tool that's been crucial for over a century, the X-ray. It's quick, painless, and often the first step in checking lung health. Think of it as a first draft helping doctors decide where to look closer. For lung cancer, that first look can be life-saving. The chest X-ray is a basic but powerful test giving doctors a starting point for diagnosis. We'll break down what an X-ray is, how it works, and what it can reveal about your lungs. By understanding this process, you'll feel more prepared and less anxious if you ever need one. Let's use this knowledge to take charge of our health and approach the future with confidence. Lung cancer starts when cells in the lungs, the very organs that sustain our breath, begin to grow uncontrollably. It's a process that can be insidious, often developing without noticeable symptoms in its early stages. These rogue cells, multiplying at an alarming rate, disrupt the normal function of the lung tissue. As these cells proliferate, they start forming tumors, masses of abnormal tissue that can interfere with breathing and other vital functions. These tumors, if not caught early, possess the dangerous ability to spread to other parts of the body, a process known as metastasis. This spread makes treatment significantly more challenging. Early detection is absolutely critical. It's the key to successful treatment and improved outcomes. The earlier lung cancer is identified, the better the chances of stopping its progression. When cancer is small and localized, confined to a specific area within the lung, the treatment options are more numerous and often more effective. This is the window of opportunity we strive to capture. At this early stage, treatments like surgery, where the tumor is physically removed, or targeted radiation, which uses high-energy rays to destroy cancer cells, are most effective in eradicating the disease. These approaches aim to eliminate the cancer before it has a chance to spread. Once cancer spreads, or metastasizes, extending beyond the lungs to affect other organs and tissues, it becomes much harder to treat, requiring more aggressive and complex interventions. The focus shifts from cure to management and extending life. There are two main types of lung cancer, each with distinct characteristics and treatment approaches: non-small cell lung cancer, NSCLC, which is the most common type, generally slower growing and often more responsive to certain therapies, and small cell lung cancer, SCLC, which is less common but known for its faster spreading and more aggressive nature. Knowing the specific type of lung cancer is crucial because it guides treatment decisions, ensuring that patients receive the most appropriate and effective therapy for their particular condition. The type of lung cancer is usually determined by a biopsy, a procedure where a small tissue sample is extracted from the lung after an abnormal X-ray raises suspicion of a potential problem. X-rays play a vital role in helping us catch cancer before it spreads, allowing for earlier intervention and improved outcomes. Think of it as spotting a small glowing ember, a tiny spark that could potentially ignite into something much larger before it becomes a raging wildfire, consuming everything in its path. The sooner we act upon these early warning signs, the quicker we can implement effective treatment strategies, the better the chances for a cure and a return to a healthy, fulfilling life. This proactive approach is the very foundation of all cancer screening programs, designed to detect the disease in its earliest, most treatable stages, being proactive in safeguarding your health rather than reactive to a crisis. Early action saves lives, offering the potential for less invasive treatments and a greater likelihood of long-term survival. It gives people the best shot at a healthy future, allowing them to continue enjoying life with their loved ones, pursuing their passions, and making lasting memories. Don't wait. Procrastination can have serious consequences when it comes to your health. Every day matters in the fight against lung cancer. The sooner you take action, the better your chances of a positive outcome. X-rays are a fast, non-invasive way to see inside your chest. The machine sends a small beam of radiation through your body. Bones show up white, air-filled lungs look dark. You stand in front of a plate, take a deep breath, and hold still for a few seconds. The process is quick and the radiation exposure is minimal. Radiologists look for anything unusual, shadows, spots, or masses that shouldn't be there. A healthy lung looks mostly dark and clear. Anything disrupting that pattern could be a clue. But not every spot means cancer. Old scars, benign nodules, or inflammation can look similar. An abnormal X-ray is just the start, not a diagnosis. It tells doctors where to look next and what questions to ask. The X-ray's real power is in raising that first crucial alarm. Radiologists look for anything out of place most often, nodules or masses. Nodules are small, round spots. Masses are larger. Both appear as white or gray shadows. Irregular or spiky edges are more suspicious for cancer than smooth, round ones. Tumors can also block airways, causing part of the lung to collapse or fluid to build up. Both show up as white areas. The location matters. Central tumors may widen the chest's middle area, while edge tumors look different. Radiologists also check bones for signs of spread. Most small nodules are benign, especially in people without risk factors. The radiologist's report will suggest next steps may be a follow-up X-ray, maybe a CT scan. Not every shadow is cancer, but every shadow deserves attention. Each detail helps build the bigger picture for your care. Early lung cancer often causes no symptoms, making it a silent threat. This is one of the reasons why it can be so dangerous. The cancer can be developing and progressing without you even knowing it, which is why screening is vital for high-risk people. Regular checkups and screenings can help catch the disease in its earliest, most treatable stages. If you have a history of smoking or exposure to other risk factors, talk to your doctor about getting screened. As tumors grow, they can cause a persistent cough, one that doesn't go away with over-the-counter remedies. It might start as a tickle in your throat, but gradually worsen over time. Changes in a smoker's cough, such as coughing more often, a deeper or raspier sound, or producing more mucus than usual. These changes should not be ignored, or coughing up blood. Even a small amount of blood in your sputum is a cause for concern and warrants immediate medical attention. Shortness of breath, even with minimal exertion, chest pain, and hoarseness that lasts for more than a few weeks are also warning signs. These symptoms can indicate that the tumor is pressing against nerves or other structures in the chest. Unexplained weight loss, fatigue that doesn't improve with rest, or loss of appetite that persists over time can signal something serious. These systemic symptoms can be a sign that the cancer is affecting your metabolism and overall health. Recurring chest infections that don't clear up despite antibiotic treatment, or a general feeling of being unwell, may also be clues. These could indicate that the tumor is obstructing your airways or weakening your immune system. If cancer spreads, symptoms can show up elsewhere, indicating metastasis to other parts of the body. Bone pain, headaches, or dizziness. These symptoms suggest that the cancer has spread to the bones or brain. The key is to listen to your body and be aware of any changes that are happening, and notice what's new or persistent. Keep track of your symptoms and how they evolve over time. Don't ignore symptoms. Talk to your doctor and share your concerns openly and honestly. If something feels off, it's always better to err on the side of caution when it comes to your health. Early action can make all the difference in the outcome of your treatment and your chances of survival. Trust your instincts and get checked out. Your health is worth the time and effort. It's always better to be safe than sorry when it comes to your health. Your vigilance could save your life, so don't hesitate to seek medical advice if you have any concerns. Finding lung cancer early is the single most important factor for survival. When caught at a localized stage, the 5-year survival rate can be over 60%. If found late after spreading, survival drops dramatically. Early detection means more treatment options and a better quality of life. Treating early-stage cancer is like pulling a single weed. Late stage is like clearing an overgrown garden. That's why screening and reporting symptoms quickly is so important. Tools like X-rays and low-dose CT scans help us spot trouble before it grows. Early treatment is often less aggressive and has fewer side effects. The goal is not just survival, but a return to normal life. Catching cancer early saves lives and preserves what matters most. X-rays are a great first step, but they can miss small or hidden tumors. That's where CT scans come in, offering detailed 3D images of your lungs. CT scans can spot tiny nodules invisible on X-rays and show exactly where a tumor is. For high-risk people, annual low-dose CT scans are now recommended and proven to save lives. These scans use much less radiation and catch cancer earlier. Other tools like MRI and PET scans help check if cancer has spread or how active it is. PET scans use a radioactive sugar to highlight cancer cells. MRI is useful for checking the brain or spinal cord. Each tool has a specific role in diagnosis and staging. Together, they give doctors a complete picture for planning treatment. If a suspicious spot is found, the next step is a biopsy, taking a small tissue sample for analysis. Biopsies can be done with a bronchoscope, a needle, or other methods, depending on the tumor's location. A pathologist examines the sample to confirm cancer and identify its type. Today, they also test for genetic mutations to guide targeted treatments. Once diagnosed and staged, a team of specialists creates a personalized treatment plan. Early-stage cancer is often treated with surgery, sometimes followed by chemo or radiation. Advanced cases may need a mix of chemotherapy, targeted therapy, or immunotherapy. Targeted drugs and immunotherapy are changing outcomes for many patients. Every treatment plan is tailored to the individual's needs and cancer type. The journey from X-ray to treatment is careful and step-by-step, aiming for the best outcome. The landscape of the fight against lung cancer has changed dramatically. It's a new era filled with advancements and hope. We've seen incredible progress in recent years, transforming what it means to live with this disease. Earlier detection, making a significant difference in treatment outcomes. Better treatments, offering more personalized and effective care. These advancements provide new avenues for managing the disease and improving overall well-being, and more survivors than ever. This is a testament to the dedication of researchers, healthcare professionals, and the resilience of patients and their families. New therapies like targeted treatments and immunotherapies are revolutionizing the way we approach lung cancer, offering hope where there once was little. Less invasive surgeries, reducing recovery times, and improving patient comfort. These advanced surgical techniques minimize trauma and allow for quicker healing. And precise radiation, targeting cancer cells with greater accuracy and minimizing damage to surrounding healthy tissue. This precision leads to fewer side effects and better outcomes. Need more hope and better quality of life. Patients are living longer, more fulfilling lives thanks to these advancements and the comprehensive care they receive. Your role is vital. You are an active participant in your healthcare journey, and your voice matters. Be proactive. Take charge of your health by scheduling regular checkups and screenings. Early detection is key. Listen to your body, paying attention to any unusual changes or symptoms that may arise. Don't ignore persistent coughs, chest pain, or unexplained weight loss, and don't delay seeking help for symptoms. Prompt medical attention can make a significant difference in the course of your treatment. If you're at risk due to smoking history, family history, or exposure to environmental toxins, it's even more important to be vigilant. Ask your doctor about low-dose CT screening, a powerful tool for early detection. It saves lives. Early detection through screening can lead to more effective treatment options and improved outcomes. Prepare questions for your appointments so you can actively engage in discussions about your health and treatment options. And speak up if you need more information. Don't hesitate to ask for clarification or further explanation on anything you don't understand. You are the most important member of your healthcare team. Your insights, concerns, and preferences are essential to creating a treatment plan that works for you. Remember, you're not alone. There's a community of people who understand what you're going through and are ready to offer support. Support groups, both in person and online, provide a safe space to share experiences, learn from others, and find encouragement. Friends and family are there for you. Lean on them for emotional support, practical assistance, and a listening ear. Hope is powerful, and it can be a source of strength during challenging times, especially when shared. Connecting with others who have faced similar challenges can inspire hope and resilience. The path may be tough, filled with ups and downs, but remember that you are stronger than you think. But you don't have to walk it alone. There are resources and people available to support you every step of the way. With early detection, we can catch the disease at its most treatable stage, significantly improving the chances of successful outcomes. New treatments and support. You have a powerful combination of resources to fight lung cancer and live a full life. There's every reason for optimism. The future holds promise for even more advancements in lung cancer care and improved outcomes for patients. Stay informed, about the latest research, treatment options, and support services available to you. Stay connected with your healthcare team, your support network, and the lung cancer community. And face the future with strength. You are resilient, capable, and deserving of a long and healthy life. Your voice and your choices matter. Be an advocate for your own health and well-being. Take charge of your health. You have the power to make a difference in your own life and the lives of others affected by lung cancer. Receiving a diagnosis of liver cancer can feel overwhelming, like navigating uncharted waters. It's natural to feel a mix of emotions: fear, confusion, and uncertainty. Take a deep breath. But remember, you are not alone. Countless individuals have walked this path before you, and there's a strong network of support available to help you every step of the way. Medical science has made incredible strides in recent years, constantly evolving and improving our understanding and treatment of liver cancer. This progress is offering more effective treatments, improved outcomes, and a greater sense of hope than ever before. This guide is designed to provide you with clear, simple, and accessible information about your condition and the various treatment options available. Our aim is to empower you with the knowledge you need to work confidently and collaboratively with your medical team, ensuring your voice is heard and your preferences are respected. Your doctors, the specialists guiding your care, nurses, the compassionate caregivers by your side, family, your unwavering source of love and strength, and friends who offer companionship and understanding are all integral parts of your support system. The first and most crucial step is understanding the specifics of your disease, the type, stage, and characteristics, and how it all comes together in your unique treatment plan. Knowledge turns fear into action, transforming feelings of helplessness into a proactive approach to your health. This understanding is key to helping you make informed decisions about your care, ensuring that your choices align with your values and goals. We'll explore what liver cancer is, delving into its origins and how it affects the body, how it's found, detailing the screening and diagnostic processes used to detect the disease, and the many ways it can be treated, from traditional therapies to cutting-edge innovations. Open communication with your healthcare providers is absolutely essential. Your questions, concerns, and observations matter deeply and should always be addressed. The ultimate goal is to care for you as a whole person, addressing not only the physical aspects of the disease, but also your emotional, psychological, and spiritual well-being. We aim to not just treat the cancer, but to support your overall quality of life throughout your journey. Let's begin this journey together, hand in hand, replacing uncertainty with understanding, fear with knowledge, and despair with hope. With your inner strength, resilience, and determination, combined with your medical team's expertise and unwavering support, you can move forward with confidence, one step at a time, towards a brighter and healthier future. Your liver is a vital organ, a powerhouse located in the upper right portion of your abdomen, just beneath your diaphragm. It's an essential component of your digestive system, playing a crucial role in maintaining your overall health and well-being. Acting as your body's filtration and energy center, it diligently filters your blood, removing toxins and waste products. Simultaneously, it processes nutrients and medications, converting them into forms that your body can use. The liver also produces bile, essential for digesting fats, and stores energy in the form of glycogen. Liver cancer starts when cells in the liver grow uncontrollably, multiplying at an abnormal rate and disrupting the normal function of the organ, forming a tumor. This mass can interfere with the liver's ability to perform its vital functions, leading to a range of health problems. This is called primary liver cancer, meaning it originates directly in the liver tissue, different from cancer that spreads to the liver from elsewhere. This type of cancer, known as secondary or metastatic liver cancer, begins in another part of the body and then spreads to the liver. Risk factors include hepatitis B or C, chronic viral infections that can cause long-term liver damage and increase the risk of developing liver cancer, and liver damage from other causes, such as cirrhosis due to alcohol abuse or non-alcoholic fatty liver disease. Early detection is crucial. It can significantly improve the chances of successful treatment and long-term survival. Finding cancer early gives the best chance for successful treatment. When detected at an early stage, liver cancer is often more treatable with options like surgery, ablation, or liver transplantation. Regular checkups are your best defense, allowing your doctor to monitor your liver health and identify any potential problems early on, especially if you're at higher risk. This includes individuals with chronic hepatitis, cirrhosis, or a family history of liver cancer. These allow doctors to spot changes before symptoms appear. Regular screening, such as ultrasound or blood tests, can help detect liver abnormalities at an early, more treatable stage. Understanding your cancer's type and stage is a critical step in determining the most appropriate treatment approach. Helps your team create a personalized treatment plan. This plan will take into account the specific characteristics of your cancer, your overall health, and your personal preferences. Medicine is advancing rapidly, with ongoing research leading to new and improved treatments for liver cancer, bringing new hope every day. These advancements offer the potential for longer survival and improved quality of life for those affected by liver cancer. Your journey starts with this knowledge: understanding what liver cancer is, its risk factors, and the importance of early detection, a foundation for your health decisions. Empowering yourself with information is the first step towards taking control of your health and making informed choices about your care. Liver cancer often causes no symptoms early on, making regular screening vital for high-risk individuals. As tumors grow, watch for unexplained weight loss, loss of appetite, or feeling full quickly. Nausea, vomiting, and pain in the upper right abdomen or back can also be warning signs. Jaundice, yellowing of the skin and eyes, signals liver trouble and needs immediate attention. Dark urine, pale stools, and abdominal swelling are other important symptoms. Persistent fatigue and weakness may also occur. These symptoms can have many causes, but don't ignore them. Never try to diagnose yourself. See your doctor if you notice new or persistent changes. Early action is a powerful step toward protecting your health. Listen to your body and seek professional advice promptly. The journey to diagnosing liver cancer begins with careful consideration and a comprehensive approach. It starts with a detailed conversation about your medical history and a thorough physical exam to check for any noticeable symptoms and assess potential less than 4 centimeters. For larger or multiple tumors, embolization blocks the blood supply, starving the cancer. Techniques like TACE and radioembolization deliver chemotherapy or radiation directly to the tumor. These therapies can control or shrink tumors, extending life and improving quality. Recovery is usually quicker than with surgery. Your doctors will choose the best approach based on your specific case. These innovative treatments offer hope for many patients. When liver cancer can't be treated locally, systemic therapies are used. Traditional chemotherapy kills fast-growing cells but can have significant side effects and limited success in liver cancer. Targeted therapies are smarter drugs that block specific cancer cell functions, often with fewer side effects. These are usually taken as pills and are now the first choice for advanced liver cancer. Some targeted drugs cut off the tumor's blood supply, slowing its growth. Immunotherapy, a newer option, helps your immune system attack cancer cells. Your doctor will test your tumor to see which therapies are best for you. These advances offer new hope and better quality of life for many patients. Systemic therapies are a major leap forward in liver cancer care. Radiation therapy uses high-energy beams to destroy cancer cells in the liver. Modern techniques like SBRT deliver precise, powerful doses with minimal harm to healthy tissue. SBRT can treat tumors that can't be removed surgically or ablated, often in just a few sessions. Radiation may also shrink tumors before surgery or relieve pain in advanced cases. The treatment is painless and quick, with sessions lasting 15–30 minutes. Side effects are usually mild, like fatigue or skin irritation. Your radiation team will personalize your plan and support you throughout. Radiation therapy is now safer and more effective than ever. It's a valuable option for many liver cancer patients. Palliative care focuses on relieving symptoms and stress, improving quality of life at any stage of liver cancer. It's not just for end of life. It can be integrated with curative treatments. The team manages pain, fatigue, nausea, and emotional challenges. They offer counseling, help with tough decisions, and connect you to resources. Early palliative care improves comfort and helps you complete treatment. It's about adding life to your days, not just days to your life. Ask your doctor about palliative care early in your journey. This support ensures your comfort and dignity remain priorities. Palliative care is a partnership for strength and well-being. Prevention and early detection are powerful tools against liver cancer. If you have risk factors like hepatitis, cirrhosis, heavy alcohol use, or fatty liver disease, regular checkups are vital. High-risk individuals should have liver ultrasounds every 6 months, sometimes with AFP blood tests. Surveillance catches cancer early when it's most treatable. Staying on schedule with screenings is a commitment to your future. Managing hepatitis, avoiding alcohol, and maintaining a healthy weight also protect your liver. Healthy lifestyle choices are powerful preventive tools. Partner with your doctor for regular monitoring. By understanding your risks and acting early, you give yourself the best defense. Take control of your liver health. Early action saves lives. We've covered what liver cancer is and the many ways it can be treated. The central message is hope. Treatments are advancing rapidly, offering new possibilities. Your journey is a partnership with your healthcare team. Your voice and questions matter. Be proactive. Ask about your diagnosis, treatment options, and side effects. Build a strong support system. Lean on loved ones and consider joining a support group. Connecting with others brings comfort and strength. Hold on to hope by focusing on small victories and trusting your team. Today, there are more ways than ever to live well with liver cancer. Take each day as it comes and be kind to yourself. You are not alone. A community of care and science is on your... Navigating health as we age can feel overwhelming. The sheer volume of information, coupled with the natural changes our bodies undergo, can sometimes leave us feeling lost and uncertain about what steps to take. It's a journey filled with questions, and sometimes a bit of anxiety. But knowledge is your greatest tool. Understanding your body, being informed about potential health risks, and knowing how to advocate for yourself are the keys to navigating this journey with confidence and control. Today, we're focusing on endometrial cancer, a type of cancer that begins in the lining of the uterus. This is a topic especially relevant for women over 40, as the risk of endometrial cancer increases with age, particularly after menopause. Understanding this risk is the first step in taking proactive care of your health. This isn't about fear. We're not here to instill worry or panic. It's about empowering you to recognize changes and seek care confidently. It's about equipping you with the information you need to make informed decisions about your health and well-being. We'll break down what endometrial cancer is, explaining its origins and how it develops within the body. We'll cover the key warning signs, the symptoms that might indicate a need for further investigation, and we'll discuss how it's diagnosed and treated, outlining the various approaches that medical professionals use to combat this disease. Many symptoms overlap with less serious conditions, which can sometimes lead to confusion or dismissal of concerns. But awareness lets you take proactive steps. It allows you to engage in informed conversations with your healthcare provider and make decisions that are right for you. For women in their 40s and beyond, as we navigate the complexities of midlife, body changes like menopause can mask or mimic other issues, making it even more important to be vigilant and informed. That's why it's crucial to pay attention to your body's signals. Listen to what your body is telling you, and don't dismiss any changes or discomforts. We'll help you distinguish between normal changes that come with age and hormonal shifts, and potential warning signs that warrant a conversation with your doctor. Trust your instincts. Your intuition is a powerful tool. If something feels off, speak up. Don't hesitate to voice your concerns and ask questions. Let's start this journey together, creating a supportive and informative space, arming ourselves with knowledge, empowering ourselves to make informed choices, and supporting each other, creating a network of strength and understanding. Your health is your power, your foundation for a fulfilling life. Let's invest in it for a vibrant, empowered future, filled with health, happiness, and well-being. Endometrial cancer. What is it, and where does it begin? It's a question that many women may find themselves asking, especially as they navigate the complexities of their reproductive health. Endometrial cancer starts in the inner lining of the uterus, the primary female reproductive organ. This lining is called the endometrium, a dynamic tissue that plays a crucial role in the menstrual cycle and pregnancy. It's a layer of cells that responds to hormonal changes, thickening and shedding each month. The uterus is where a baby grows during pregnancy, providing a nurturing environment for fetal development. It's a muscular organ designed to expand and contract, supporting the growth of a new life. And its lining, the endometrium, changes monthly in response to hormones like estrogen and progesterone. These hormonal fluctuations prepare the uterus for potential implantation of a fertilized egg. Endometrial cancer happens when cells in this lining undergo abnormal changes. These cells grow uncontrollably, dividing and multiplying without the normal checks and balances, ultimately forming a tumor. This tumor can then invade surrounding tissues and potentially spread to other parts of the body. It's the most common gynecologic cancer in the U.S., affecting a significant number of women each year. Understanding its prevalence is the first step in promoting awareness and early detection. It's usually diagnosed after menopause, when hormonal changes can sometimes increase the risk. However, it's important to remember that it can occur in younger women as well. Unlike cervical cancer, which affects the cervix, the lower part of the uterus, or ovarian cancer, which originates in the ovaries, endometrial cancer specifically affects the uterine lining, the endometrium. This distinction is crucial for understanding the specific symptoms and treatment approaches. Symptoms often relate to abnormal uterine bleeding, such as changes in menstrual cycles, bleeding between periods, or postmenopausal bleeding. This often leads to early detection, as women are more likely to seek medical attention for these noticeable changes. Most uterine cancers are endometrial, meaning they originate in the endometrium. So the terms uterine cancer and endometrial cancer are often used interchangeably in medical discussions. However, it's important to note that there are other, less common types of uterine cancer. The good news is that early symptoms often mean it's often caught early when it's most treatable, leading to better outcomes and improved quality of life. Knowing what to look for lets you act quickly and seek medical advice promptly. This proactive approach significantly improves outcomes and increases the chances of successful treatment. The development is usually slow, often taking months or even years for the cancer to progress. This gives you a window to catch it and intervene before it becomes more advanced. This is crucial because catching it before it spreads significantly improves the chances of successful treatment and long-term survival. Understanding these basics empowers you to take control of your health. It allows you to recognize important symptoms and advocate for your well-being. Next, let's talk about the most common warning sign, the symptom that often prompts women to seek medical attention and ultimately leads to a diagnosis. When it comes to endometrial cancer, being aware of your body and any changes is absolutely crucial. Early detection significantly improves treatment outcomes, and one of the most telling signs is something many women experience. Reporting abnormal bleeding is responsible and proactive. It demonstrates a commitment to your health and well-being. It's the single most important step for early detection of endometrial cancer, significantly increasing the chances of successful treatment. Trust yourself. Your vigilance and attention to your body can save your life. Don't hesitate to seek medical advice when something feels off. Now, let's look at other symptoms to watch for, which, in combination with abnormal bleeding, can provide a more complete picture. While abnormal bleeding is most common, some women experience pelvic pain or pressure. This might feel like a persistent ache or fullness in your lower abdomen, unrelated to your period. As a tumor grows, it can press on nearby organs, causing discomfort. Unusual vaginal discharge, watery, pink, brown, or foul-smelling, can also be a warning sign. These symptoms are less common early on but become more noticeable as cancer progresses. Persistent pain or new, unusual discharge should prompt a doctor's visit. Track your symptoms, note when they occur and how long they last. This information helps your doctor understand what's happening. Don't ignore changes. Your body is communicating with you. Early attention to these signs is key to your health. Less common symptoms include pain or difficulty during urination and pain during sex. A tumor pressing on the bladder can cause burning, urgency, or incomplete emptying. Painful intercourse, especially deep pelvic pain, may occur if the tumor affects surrounding tissues. These symptoms are often caused by other conditions like infections or dryness, but if they're new or persistent, see your doctor. If these issues occur alongside abnormal bleeding or pelvic pain, they're even more significant. Don't self-diagnose or ignore persistent changes. Your doctor can help determine the cause and guide you to the right care. Being informed helps you advocate for your health. Understanding your risk factors helps you and your doctor make informed decisions. The biggest risk: excess estrogen without enough progesterone, often linked to obesity. Early periods, late menopause, never being pregnant, and conditions like PCOS can increase risk. Hormone replacement therapy with estrogen alone raises risk if you still have your uterus. Family history, especially Lynch syndrome, also matters. Having risk factors doesn't mean you'll get cancer, but it's important to stay vigilant. Discuss your history and risks with your doctor. Awareness and healthy habits are your best defense. If you report symptoms, your doctor will start with a conversation and a pelvic exam. A transvaginal ultrasound checks the thickness of your uterine lining and looks for other causes. If the lining is thickened or symptoms are suspicious, an endometrial biopsy is next. This quick office procedure collects a tissue sample for lab analysis. Sometimes a hysteroscopy with D&C is needed for a larger sample. These steps confirm if cancer is present and guide your treatment plan. Early diagnosis is key to successful treatment. Don't hesitate to seek answers if you notice symptoms. Your proactive approach makes a difference. A cancer diagnosis is life-changing, but endometrial cancer is highly treatable, especially when caught early. Surgery, usually a hysterectomy, sometimes with removal of ovaries and fallopian tubes, is the main treatment. Lymph nodes may also be removed to check for spread. Many early-stage cases need only surgery. Additional treatments like radiation, chemotherapy, or hormone therapy may be recommended based on your cancer's type and stage. Radiation can be external or internal. Chemotherapy is for more advanced cases. Hormone therapy blocks hormones that fuel certain cancers. Your oncology team will explain your options and help you choose the best plan. Support and information empower you through treatment. Early detection is your greatest ally. When found early, endometrial cancer has a 5-year survival rate over 95%. Never ignore abnormal bleeding, especially after menopause. See your doctor promptly. Regular gynecologic checkups are essential for discussing changes and reviewing your risk. Maintaining a healthy weight and active lifestyle reduces your risk and supports overall well-being. Small, consistent choices make a big difference for your long-term health. Be curious and proactive about your body. If you notice symptoms or have concerns, reach out to your doctor. Open communication is the foundation of good care. You are your own best advocate. Stay informed, stay empowered, and prioritize your health.
For decades, the very word leukemia carried a heavy weight. It was a term whispered with fear, a diagnosis that often felt like a life sentence. Families trembled at the news, unsure of what the future held. It was a diagnosis that cast a long shadow, stretching across lives and dimming hopes. The treatments were harsh, the outcomes uncertain, and the emotional toll immense. But today, July 12, 2025, a new chapter begins. The sun rises not just on a new day, but on a new era of possibilities. We stand at the threshold of a new era, where scientific breakthroughs are transforming the landscape of leukemia treatment. The story of leukemia is rapidly becoming one of hope, resilience, a testament to the strength of the human spirit in the face of adversity. It's a story of remarkable scientific achievement, driven by relentless curiosity and a deep commitment to improving lives. This transformation is the result of tireless work by researchers, patients, and doctors worldwide, a global collaboration dedicated to conquering this disease. Breakthroughs once thought impossible, the stuff of dreams and science fiction, are now saving lives, offering new hope, and extending the horizons for those affected by leukemia. We can now harness the power of the immune system, unlocking its potential to fight cancer cells with remarkable precision. We can design drugs that target the genetic roots of leukemia, attacking the disease at its source with unprecedented accuracy. Survival rates are rising, steadily climbing as new treatments and therapies emerge. Less and less room for the normal functioning cells that the body needs to survive. red blood cells. Some experience bone pain or enlarged organs. These signs are often mistaken for other illnesses, delaying diagnosis. Recognizing them early can save lives. Now let's see how treatments have evolved. For years, chemotherapy was the main weapon against leukemia, powerful drugs that kill fast-dividing cells. While effective, chemo can't distinguish between cancer and healthy cells, causing side effects like hair loss, nausea, and immune suppression. Bone marrow transplants, another cornerstone, involve wiping out diseased marrow and replacing it with healthy donor cells. This can cure leukemia, but is risky, with complications like graft versus host disease and difficulty finding a match. These treatments, though life-saving, are grueling and come with significant risks. The need for better, less toxic therapies has driven innovation. Enter immunotherapy and targeted treatments. Immunotherapy is revolutionizing leukemia treatment by empowering the immune system to fight cancer. Cancer often hides from immune cells, but new therapies remove these breaks. CAR T-cell therapy is a breakthrough. Doctors engineer a patient's own T-cells to hunt and destroy leukemia cells. These supercharged cells are infused back, creating a living army against cancer. Results have been stunning. Patients once out of options are now in remission. Emily Whitehead, the first child to receive CAR T-cell therapy, has been cancer-free for years. This approach offers hope where none existed before. Immunotherapy is changing the game, making cures possible for many. Next, let's explore targeted therapy's precision. Targeted therapy is precision medicine in action. Instead of attacking all dividing cells, these drugs zero in on genetic mutations unique to leukemia. For example, imatinib, Gleevec, targets the BCR-ABL protein in chronic myeloid leukemia, turning a fatal disease into a manageable condition. Similar drugs now exist for other leukemia types with specific mutations. Targeted therapies mean better outcomes and fewer harsh side effects. Treatment is tailored to each patient's cancer profile. This smart approach is transforming leukemia care. Let's see how stem cell transplants have evolved. 4. Stem cell transplants have become safer and more accessible. International donor registries and advanced matching techniques have improved outcomes. Stem cells can now be collected from blood or umbilical cord blood, expanding options for patients. Many transplants use lower doses of chemo, making the procedure possible for older or frailer patients. The graft versus leukemia effect leverages the donor's immune system to fight cancer. Survival rates have improved, and complications are better managed. For many, a transplant offers the best chance for a cure. It's a testament to medical progress and human generosity. The future of leukemia treatment lies in gene therapy and clinical trials. Next-generation CAR T-cells and gene editing tools like CRISPR are being developed to target cancer even more precisely. Off-the-shelf CAR T-cells from donors could make these therapies widely available. Clinical trials are the bridge from lab to patient, testing new drugs and approaches. Patients in trials access cutting-edge treatments and help advance science for all. The future is personalized, treatments tailored to each patient's genetics and needs. The goal is not just remission but cure, with the best quality of life. This vision is becoming reality, thanks to relentless innovation. Progress in the fight against leukemia and other blood cancers isn't just a statistic, it's a tangible reality. It's measured not only in research papers and clinical trials, but more importantly, in lives changed, in families reunited, and in futures reclaimed. Each success story is a testament to the relentless dedication. challenges of leukemia. The future is bright and hope is real. With continued dedication and collaboration, we can make a world without leukemia a reality. Thank you for joining this journey toward a world without leukemia. Your support in any... We all love a beautiful sunny day, but hidden in that sunshine is an invisible threat. Ultraviolet or UV rays. These rays are the leading cause of skin cancer, the most common cancer worldwide. The damage from UV rays is cumulative, building up from your very first sunburn. Every unprotected moment in the sun adds to your risk, making prevention a daily habit, not just a vacation concern. Understanding how UV rays affect our skin empowers us to make smarter choices. We'll break down what skin cancer is, how UV triggers it, and who's most at risk. We'll show you the warning signs and the best ways to protect yourself. Early detection and prevention are your best defenses. The power to prevent most skin cancers is truly in your hands, starting today. UV-related skin cancer starts when UV rays damage the DNA in your skin cells, causing them to grow uncontrollably. There are three main types: basal cell carcinoma, squamous cell carcinoma, and the most dangerous, melanoma. Basal and squamous cell cancers usually appear on sun-exposed areas and can cause serious local damage if ignored. Melanoma, though less common, is far more aggressive and can spread quickly if not caught early. Even a few bad sunburns, especially in childhood, can set the stage for melanoma years later. Skin cancer is not random. It's a direct result of repeated UV injury. The good news? Most cases are preventable with the right daily choices. Prevention starts with understanding this connection. The sun emits two types of UV rays that damage our skin: UVA and UVB. UVB causes sunburn and direct DNA damage. UVA penetrates deeper, accelerating aging and also triggering cancer. Both are dangerous and both are present even on cloudy days or through windows. There's no such thing as a safe tan. A tan is your skin's injury response to DNA damage. Tanning beds are even worse, delivering intense UV doses that dramatically increase your risk of melanoma. Using a tanning bed before age 35 raises your melanoma risk by 75%. The myth of a base tan protecting you is just that, a myth. All UV exposure adds up, and all of it is harmful. Fair-skinned people who burn or freckle easily are at higher risk, but no one is immune. A history of sunburns, especially in childhood, increases your lifetime risk. Many moles, unusual moles, or a family history of skin cancer also raise your risk. Living near the equator at high altitudes or spending lots of time outdoors increases exposure. People with darker skin have more natural protection, but they can still get skin cancer, often diagnosed later and at more dangerous stages. The sun doesn't discriminate, everyone is at risk. Tanning beds are dangerous for all skin types. Don't assume it won't happen to me. We all need to take precautions every day. The best defense is knowing your own skin. Perform monthly self-exams and look for any new or changing spots. Watch for the ABCDEs of melanoma: asymmetry, border irregularity, color variation, diameter over 6 mm, and evolving shape or symptoms. Basal cell cancers may look like pearly bumps or sores that don't heal. Squamous cell cancers may be red, scaly, or crusted. Check your whole body, including hard-to-see areas. Use mirrors or ask for help. Early detection means simple, effective treatment. Don't panic if you find something. See a doctor promptly. A few minutes each month could save your life. Most skin cancers are preventable with a few simple habits. Use broad-spectrum sunscreen, SPF 30 or higher, every day, and reapply every 2 hours or after swimming. Seek shade, especially between 10 a.m. and 4 p.m., when the sun is strongest. Wear protective clothing: long sleeves, pants, wide-brimmed hats, and UV-blocking sunglasses. Many clothes now have UPF ratings for extra protection. Make sun safety part of your daily routine, not just for the beach. UV rays are present year-round and can reflect off water, sand, and pavement. Keep sunscreen and a hat handy. Small, consistent actions add up to powerful protection. Prevention is easier than treatment. Start today. Monthly self-exams are vital, but professional skin checks are just as important. See a board-certified dermatologist for a full-body exam, especially if you have risk factors. Your doctor can spot subtle warning signs you might miss. How often you need checkups depends on your risk. Ask your dermatologist for guidance. Point out any spots you're worried about, even if they seem minor. If something looks suspicious, a quick biopsy can provide answers. Early detection means simpler treatment and better outcomes. A professional skin exam could save your life. If you're diagnosed with skin cancer, there's more hope than ever. Most cases caught early are cured with minor surgery. Mohs surgery removes cancer layer by layer, preserving healthy skin. For advanced melanoma, new targeted therapies and immunotherapies have revolutionized treatment and survival. Early detection means less invasive treatment and better results. Prevention and vigilance are still your best defense. Modern medicine offers a safety net, but it's not a substitute for sun-safe habits. Stay proactive, your health is worth it. Knowledge is only powerful if you use it. Make sun protection a daily habit. Wear sunscreen hats and seek shade as routine self-care. Teach children sun-safe habits early, their future health depends on it. Remind friends and family to protect their skin and check suspicious spots. Share what you've learned. Awareness saves lives. Challenge myths about tanning and encourage regular skin checks. Skin cancer is preventable, but only if we act. Respect the sun's power, but don't fear it. Protect your skin, know your body, and see your doctor regularly. The power to prevent skin cancer is in your hands. Use it wisely.
For years, a diagnosis of stage 4 cancer carried a weight of despair, often perceived as an insurmountable challenge. It was a moment when hope seemed to dwindle, casting a long shadow over patients and their loved ones. It felt like a final chapter, the closing of a book with limited options and a sense of finality. The future seemed predetermined, shrouded in uncertainty and fear. But today, that narrative is changing fast. The landscape of cancer treatment is undergoing a profound transformation, offering new avenues of hope and possibilities that were once unimaginable. Scientific breakthroughs are transforming how we treat advanced cancer, with relentless research and cutting-edge technologies paving the way for innovative therapies. These advancements are offering not just more time, extending life expectancy, but also focusing on better quality of life, ensuring patients can live fuller, more meaningful lives during their treatment journey. Researchers are decoding cancer's secrets, unraveling the complexities of the disease at a molecular level, gaining insights that were previously out of reach. This deeper understanding is leading to smarter, more precise treatments, targeting cancer cells with greater accuracy and minimizing harm to healthy tissues. We're entering an era of personalized medicine, where treatment strategies are no longer one-size-fits-all, but rather tailored to the individual characteristics of each patient. This means therapies are tailored to each patient's unique cancer, taking into account their genetic makeup, the specific mutations driving their disease, and other individual factors. This shift is turning a sprint against time, the urgent race to combat the disease, into a marathon of possibility. It's about endurance, resilience, and the long-term management of the disease, with the goal of extending life and improving well-being. Hope is now a strategy, a proactive approach to fighting cancer, fueled by scientific advancements and a commitment to personalized care. It's found in labs where dedicated scientists are tirelessly working to discover new and more effective treatments, clinics offering state-of-the-art care, and the comfort of palliative care, providing support and relief from symptoms to enhance the quality of life for patients and their families. In this video, we'll explore what a stage 4 diagnosis means today, examining the evolving understanding of the disease and the factors that influence its progression. We'll delve into the treatments extending lives, showcasing the latest breakthroughs in chemotherapy, immunotherapy, targeted therapy, and other innovative approaches. And we'll share stories of those living proof that this isn't the end, highlighting the experiences of cancer survivors who are defying the odds and living full, vibrant lives. The future of advanced cancer care is brighter than ever, filled with hope, innovation, and a renewed commitment to improving the lives of those affected by this disease. When we talk about stage 4 cancer, it's a phrase that often carries a lot of weight. It signifies a significant progression of the disease. Stage 4 cancer means the disease has spread from its original site, where it first began, to distant parts of the body, reaching other organs or tissues far from the primary tumor. This spread is what defines stage 4. This spreading process is called metastasis. It's a complex series of events where cancer cells break away from the original tumor, travel through the bloodstream or lymphatic system, and then form new tumors in other parts of the body. The presence of metastasis makes treatment more complex, requiring a multifaceted approach that addresses both the primary tumor and the secondary tumors that have formed elsewhere. Because of the widespread nature of the disease, the goal of treatment often shifts from cure to control. The focus becomes managing the cancer, slowing its growth, and alleviating symptoms to improve the patient's overall well-being. It's important to remember that each type of stage 4 cancer behaves differently. The The specific characteristics of the cancer, its rate of growth, and its response to treatment can vary significantly. This variability means that treating stage 4 cancer requires unique approaches tailored to the individual patient and the specific type of cancer they have. A one-size-fits-all approach simply isn't effective. Fortunately, advances in genetic testing now allow doctors to gain a deeper understanding of the molecular makeup of each patient's cancer. This detailed information allows them to personalize treatment based on the tumor's specific mutations, targeting the unique vulnerabilities of the cancer cells. As a result, two patients with the same cancer diagnosis, such as lung cancer or breast cancer, may receive entirely different therapies, each tailored to their individual genetic profile and the specific characteristics of their disease. Today, a stage 4 diagnosis is increasingly managed more like a chronic illness, similar to conditions like diabetes or heart disease. The focus is on controlling symptoms, preventing complications, and maintaining quality of life for as long as possible, allowing patients to live full and meaningful lives. Thanks to advances in treatment and supportive care, many patients are living for years with stage 4 cancer, working, traveling, pursuing their passions, and spending precious time with loved ones, demonstrating that a stage 4 diagnosis doesn't necessarily mean the end of an active and fulfilling life. The conversation surrounding stage 4 cancer has shifted significantly from the outdated notion of how much time is left to a more proactive and hopeful dialogue centered on how can we make this time the best it can be, focusing on maximizing quality of life and creating meaningful experiences. Stage 4 cancer is no longer a hopeless verdict, but rather a complex condition that can be managed effectively with the right treatment and support, allowing patients to live longer, fuller lives. Before we dive into new treatments, let's look at the foundations: chemotherapy, radiation, and surgery. Chemotherapy uses drugs to kill fast-growing cancer cells throughout the body, aiming to control rather than cure in stage 4 cases. It can shrink tumors, relieve symptoms, and slow progression, but often comes with tough side effects. Radiation targets specific areas to relieve pain or other symptoms, especially when tumors threaten vital organs. Surgery is less common for widespread cancer, but can help prevent complications or remove isolated metastases in select cases. These traditional treatments remain vital, often used alongside newer therapies. They've laid the groundwork for today's advances. The goal: extend life, relieve suffering, and support patients through every stage. Modern cancer care builds on these pillars. The biggest breakthroughs in stage 4 cancer treatment are immunotherapy and targeted therapy. Immunotherapy empowers the patient's own immune system to attack cancer, often leading to long-lasting remissions in tough cancers like melanoma and lung cancer. Checkpoint inhibitors release the brakes on immune cells, letting them recognize and destroy cancer. Targeted therapy uses genetic insights to attack specific mutations driving a tumor's growth, often with fewer side effects. For example, a pill can block a mutated protein in lung cancer, halting its progress. These therapies can turn aggressive cancers into manageable conditions. Sometimes doctors combine them for even greater effect. This multi-pronged approach is redefining survival and hope for stage 4 patients. Precision medicine is changing the game. Palliative care is often misunderstood. It's not just for end of life, but for improving quality of life from diagnosis onward. It focuses on relieving symptoms and stress, helping patients live as well as possible while undergoing treatment. A team of specialists manages pain, nausea, fatigue, and emotional challenges. Palliative care supports patients and families, guiding tough conversations and future planning. Integrating it early helps patients tolerate treatments and maintain strength. Studies show it can even extend life for those with advanced cancer. It's about living fully, not giving up. Palliative care is an essential part of the best cancer care. It treats the whole person, not just the disease. Clinical trials are the engine of progress in cancer care. They offer patients access to cutting-edge treatments before they're widely available. Most trials compare new therapies to the current standard, so every participant receives active treatment. Resources and advocacy groups help patients find trials that fit their needs. Joining a trial is a courageous, hopeful step, benefiting both the patient and future generations. Clinical trials are not a last resort, but a proactive choice at the frontier of medicine. They drive the breakthroughs changing lives today. We often hear stories about cancer, but it's important to remember that every individual's journey is unique. There are real people, just like you and me, facing this challenge with incredible strength and resilience. And what's truly remarkable is what's possible with today's treatments. Medical science has advanced at an astonishing pace, offering new hope and possibilities for those diagnosed with even advanced stages of the disease. These modern facilities and cutting-edge technologies are at the forefront of this revolution. Take David, for example, a dedicated teacher and avid hiker, someone who found joy in both the classroom and the great outdoors. He received the life-altering news that he was diagnosed with stage 4 melanoma. It was a moment that could have defined him, but instead, it ignited a fire within him to fight. The diagnosis revealed that the cancer had unfortunately spread to his lungs and brain, making his situation even more complex and challenging. But thanks to his participation in a clinical trial for immunotherapy, a groundbreaking approach that harnesses the power of the body's own immune system, his cancer remarkably shrank. The treatment proved to be a turning point, offering him a chance to reclaim his life. And with renewed vigor, he returned to his passions, embracing the activities that brought him joy and fulfillment. He found solace and strength in nature, proving that life doesn't have to stop after a diagnosis. Now, he's managing cancer as a chronic condition, integrating treatment into his daily life, and proving that it's possible to live a full and meaningful life even with advanced cancer. Then there's Emily, a young mother whose world was turned upside down by a cancer diagnosis. She was diagnosed with stage 4 lung cancer, a devastating blow that threatened her dreams and her ability to raise her children. But Emily's story took a hopeful turn when she benefited from genomic testing, a revolutionary approach that analyzes the genetic makeup of her cancer. This testing revealed a treatable mutation, a specific vulnerability in her cancer that could be targeted with precision. As a result, a daily pill specifically targeted her cancer, attacking the mutation and slowing its growth. This targeted therapy allowed her to continue caring for her children, being present in their lives and creating precious memories. And not just care for them, but live with energy, participating fully in their lives and embracing every moment. These stories aren't miracles, they're not random occurrences or flukes of nature. Instead, they're the direct result of years of dedicated research and relentless innovation in the field of cancer treatment. Because of these advancements, more and more patients are living well and long, defying the odds and exceeding expectations. They're defying old expectations, challenging the perception of what it means to live with advanced cancer. Personalized medicine and new therapies are transforming the landscape of cancer care, offering hope where there once was despair. These advancements are rewriting what it means to have advanced cancer, shifting the focus from survival to quality of life. Hope is real, and it's growing, fueled by scientific breakthroughs and the unwavering spirit of patients and their families. Living fully with stage 4 cancer is possible, and these stories are a testament to the power of hope, resilience, and the unwavering pursuit of a better future. The future of cancer treatment is accelerating. CAR T-cell therapy, which engineers a patient's immune cells to fight cancer, is expanding from blood cancers to solid tumors. Liquid biopsies, simple blood tests, will soon detect and monitor cancer more easily and precisely. Doctors are combining therapies in smarter ways, including cancer vaccines and AI-driven treatment plans. The goal: turn more stage 4 cancers into manageable conditions and ultimately find cures. Progress in the last decade has been breathtaking. The next decade promises even more breakthroughs. Innovation is fueling hope for a better tomorrow. Progress against stage 4 cancer is a global effort. Scientists, doctors, patients, and all of us. Supporting research through donations and advocacy accelerates new treatments. Raising awareness and fighting stigma creates a more supportive environment for patients. Open conversations about screening, treatment, and palliative care matter. Advocating for access to care and clinical trials ensures no one is left behind. Every action, big or small, helps push the boundaries of what's possible. This fight is a marathon, not a sprint. Together, we can turn a stage 4 diagnosis from an endpoint into a new beginning. The next chapter in cancer care is ours to write.